Good afternoon. Welcome to our session today. We have an important guest from our mayor's office of people with disability for disability. Hold on one second. Mayor's office for people with disabilities. And her name is Clarissa Stanhope, and she will take you from here with this session.
Great, thanks so much. Yeah, so my name is Claire Stanhope, and I'm the training officer at the Mayor's Office for People with Disabilities. And today we're going to talk about how to serve customers with disabilities and a little bit about our business enterprise owned by people with disabilities. So on our agenda, we're going to start with an introduction to the Mayor's Office for People with Disabilities. Then we'll talk about disability and accessibility, some about ADA and public accommodations, how to have effective communication with people with disabilities, and then we will wrap up about our business owners with disabilities. So as an introduction to the Mayor's Office for People with Disabilities, or MOPD, really, our vision is just to have full participation and equal opportunity for our residents with disabilities in the city of Chicago. We do like to really aim big, and we're working to make the city the most accessible and inclusive city in the world. On the right is a mural from our Central West location. So we have two locations. One is at City Hall downtown, 121 North LaSalle, and then the other one is in Central West in 2102 West Ogden, and that's where there are murals. So there are a variety of representations of disability on those murals, and I encourage you to check it out if you're ever in the area. To touch on some of our programs and services, we have an accessibility compliance unit that works to make sure that the city is built accessibly for everybody. We also have a career center that serves individuals with disabilities and a communication access team. So that's 3 on-staff American Sign Language interpreters who work in press conferences and other city departments to help make our city services accessible through communication. We also have a disability resource unit, and through that we have home delivered meals and an independent living program that provides personal assistance to people with disabilities. We have a gun and community violence project, and so that program works with individuals who've been impacted by gun and community violence through organizations that serve them to help make sure that the organization services are accessible for those individuals. We have a home mod program that will modify homes to make sure that they're accessible so that people can continue to live independently in the community. We do public policy, we have training, which is why we're all here today, and then we do have a substance use prevention program specifically for students who are deaf or hard of hearing. So to start off with disability and access, first I'd just like to show this picture and ask you to reflect to yourself how many individuals in this photo you think might have a disability. So there are 7 individuals. I'll give a visual description of them. On the left, there is an individual who looks like they have assistive technology for a hand. Then in the middle, there's somebody who is wearing sunglasses and has a cane and has a person on their arm. And then there are 4 individuals to the right. One is sitting in a wheelchair and one has a, a leg that looks like maybe it's an assistive device. So out of those 7 individuals, think to yourself how many you think might have a disability, and we'll come back to that in a moment. So we use the Americans with Disabilities Act of 1990 to define disability, and there's really 3 different components of disability. So the first is a physical or mental impairment that substantially limits one or more major life activities. And a major life activity can really be anything. So it could be breathing, it could be walking, it could be being able to bathe yourself or take care of your home. So a lot of things fall under a major life activity. It also covers a person who has a history or record of such an impairment. And so a history of an impairment may be something such as someone who was diagnosed with cancer, they've gone through treatment, they're in remission, they no longer have cancer, but because they have a history of that disability, they would be covered under the ADA as having a disability. And the last category is a person who is perceived by others as having such an impairment. And so that could be because somebody has something physically different about them, and so people assume that they have a disability, or it could be maybe you're observing behavior and you're assuming that somebody maybe has a mental health condition, but you really don't know. That perception would qualify them to be protected under the ADA as having a disability. So in the United States, disability is super prevalent. About 27% of adults in the United States report living with at least one disability. So that's about 1 in 4 individuals. And then as we age, disability is actually reported more frequently. So about 36% of adults age 65 plus report having at least one disability. And we know that these numbers are underreported. So when we talked about the definition of disability, that's under the ADA, but there's also medical definitions of disability. There's also self-identity, whether you identify as having a disability. So really reporting on disability is often underreported because of how many different definitions of disability there are. So on the left, there are 2 individuals highlighted in red out of 10, and that's to represent the 20% of adults in the United States that report living with at least one invisible disability. So what an invisible disability is if you're not communicating with someone and you're not observing the behavior, you really wouldn't know that they have a disability. So oftentimes we think we would know who has a disability because we'd be able to see it, but most of the time we actually really can't see the disability. So being blind or low vision could be an invisible disability. Having autism could be an invisible disability. So 20% of disabilities are invisible. So when we return to this photo that I had you look at in the beginning, the reality is we really don't know how many individuals have a disability because disability can be invisible. So, when you're looking at this, I think oftentimes we look for visible differences among these individuals, but really we don't know how many individuals have a disability. We also don't know who identifies as having a disability, and we also need to think about our own perception of disability. So I asked you to kind of make judgments about these individuals, and so you might have assumed that the man who's wearing glasses and holding a cane and has a woman on his arm maybe is blind and is being guided somewhere. But in reality, he could just be a hiker going out for a hike on a sunny day with his hiking cane and his girlfriend. So just to keep in mind our own perceptions about disability and what that might look like. So when we talk about disability, it's really important that we all have similar language and inclusive language. So disability is not a bad word and neither is disabled. It's okay to say a person with a disability. So we use person first language as best practice. So that's person with disability rather than identity first, which is disabled person. So person first language, person with disability. That's best practice, but there are some communities that prefer identity first language. One of these communities is the autism community. So sometimes individuals will prefer to identify as an autistic individual rather than a person with autism. But really, it's just best to wait until somebody tells you how they identify and whether to use person first or identity first language. But keep in mind, disability is not a bad word. And so sometimes we use special needs or differently able to kind of hop around the subject, but it's more than okay to just say disability. We also want you to avoid using the term handicap. This word is actually from a really derogatory meaning less than. And so when we're talking about people with disabilities as having a handicap, we're really talking about them as less than. So if any of you play golf and the player who has a handicap, they're the worst player. So that's kind of a way to think about it that kind of makes you remember that this really does have a derogatory meaning. So when we're talking about parking spaces or bathrooms, we encourage you to swap out the language just to use accessible rather than handicap. So an accessible bathroom or accessible parking. We also no longer use the term mental retardation or mentally challenged, and instead we use the terms intellectual, developmental, or cognitive disability, and neurodiverse is a term we've heard a lot more frequently and we'll touch on in the end. When we're talking about individuals who are deaf or hard of hearing, you'll see the capital D for deaf, and that's the proper way to talk about it. Also, we'll talk about these individuals as deaf or hard of hearing rather than hearing impaired. So when you talk about a hearing impairment, an impairment means that something's wrong, but in reality, individuals from this community would say there's nothing wrong with me. Instead, I communicate differently than you do. And on our last category here, these are service animals. Sometimes service animals are guide dogs, and so they may guide an individual who's blind or low vision, but we avoid saying seeing eye dogs because they are not quite literally a pair of eyes that are seeing for an individual, but they're rather a guide dog guiding that individual. And service animals can have a lot of different roles. So, service animals can be trained to alert people to sounds and alarms in the environment. They can be trained to alert somebody to an oncoming seizure or maybe high glucose levels. They can retrieve items for people or open up refrigerators, help prepare wheelchairs. So really service animals have a lot of different tasks that they're trained to perform, and therefore, using the inclusive language service animal is really best practice. So when we talk about disability, we then have to talk about accessibility. And that's the way that we design our products or services or our physical environment to be available and usable by everybody, no matter how they encounter it. And so this is really important for multiple reasons. It is the law under the ADA, and it also benefits everybody. So if you think about a ramp, for example, ramps are really made for individuals who are using wheelchairs to be able to enter and exit without going up and down stairs. But somebody who's walking can also use that ramp, and a parent with a stroller or a traveler with a rollerboard suitcase, somebody who maybe biked to work that day, everybody benefits from that ramp, and therefore ramp is a great accessibility feature. And then also, it just makes sure that everybody is able to participate in the great services that you provide and the activities that you organize. So there are three types of accessibility that we talk about: physical, digital, and communication. But today we're really going to be focusing on physical access and communication access. So when you're thinking about the physical access of your space so that you can serve individuals with disabilities, you'll want to think about how people are able to enter and exit your space. So are there stairs? Is there a ramp? How are people able to even get into your space? And then once they're into the space, are they able to navigate without physical barriers? Can they utilize all the features available similar to everyone else? So are water fountains of an appropriate height? Are there accessible bathrooms available? And then in terms of the built environment, such as furniture, how are we able to have those be accessible for people? So are people able to access countertops and tables? Is seating movable? And is it flexible? So is there flexibility in how the space can be used? So if an individual who's using a wheelchair comes in, are we able to raise or lower the table to accommodate them? And how are we able to make changes? So some examples of physical access. Automatic door openers are a great example of physical access that we don't think about very often, that are originally for people who use wheelchairs but benefits everyone. Um, Additionally, curb cuts and curb ramps, and that goes along with tactile pavement. Those are those bumps at the end of curb ramps that let you know that the sidewalk will be ending now. There's also like platform lifts. That's kind of like on CTA buses. If you've ever heard that big sound of air and then it goes down, a platform lift could help an individual who's using a mobility aid get on, and many other forms of physical access. So there's also communication access. And so when we're talking about communication access, we're talking about information and access to information and communication with other individuals. So it's important to think about what written information is being communicated and what auditory information is being communicated, and making sure that all communication is happening in both forms. You also want to think about how staff or individuals are prepared to communicate with individuals, and specifically individuals with disabilities. So participating in a training to be prepared to serve individuals with disabilities is a great way to prepare your staff for communication access. And then, oftentimes we think technology is great, and it so is, but sometimes technology can fail us, and it's a good idea to have a backup system just in case technology is not working. So some examples of communication access: American Sign Language interpreters, audio descriptions. Those are, you can turn them on Netflix actually. They describe the scene that's happening visually in addition to the auditory information. So if you see a character enter a scene, they maybe wave and say, "Hi, Bob," you would see that all happen. There's also captioning, closed captions, open captions as part of videos. There's large print materials and many other forms of communication access. So now let's talk about access in terms of the Americans with Disabilities Act, or ADA, and public accommodations. So there are 5 titles of the ADA, but what we're going to focus on today is Title 3, which is public accommodations. So, Title 3 prohibits discrimination against people with disabilities in places of public accommodations. And so a public accommodation is not just like a government public facility. It can be a privately owned business that fits into the below 12 categories. So lodging, food and drink, exhibition or entertainment, a public gathering, sales or rental spaces, service spaces, public transportation such as terminals, depots, and stations, public display or collection, so like museums, recreation, education, social service centers, and exercise or recreation places. So, public accommodations are required to make reasonable modifications to their programs and practices and procedures to make sure that the goods and services they offer are available to people with disabilities. So, they may have to make modifications, they may have to add in aids or services and remove architectural barriers. So sometimes there are grandfather provisions. So if something was already there beforehand, they don't make you change it, but this does not exempt a business from their obligation under the ADA to be accessible to the public. So in terms of barrier removal, there are lots of different ways that you can remove barriers. A really good first practice is to just assess your current practices and facility. You can start with some of those questions I provided about the physical barriers in your space, kind of assessing that, and then thinking about how staff are prepared to communicate and some communication barriers. You can also train staff on disability so that they're prepared to communicate appropriately, and then have a process and a point person in case somebody does request an accommodation. So now we're going to talk about effective communication. I typically show this video. Let me see if it is going to play. This video is called Awkward Bob, and it just does a really nice job of showing us some things that people do to people with disabilities that we don't always realize. It's humorous, but it's also a little awkward, so it's okay to laugh, and it's also okay to feel a little uncomfortable.
Good morning, Bob. Morning there. Man. Morning, Alice. There's no need to be awkward.
Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone. Good.
Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait. Oh no, might actually not.
If you'd like to offer me help, let me hold on to your elbow. Don't take mine.
Hey, would you like to take mine?
Sure.
Assistive devices help us to live our lives. They're really important and really personal.
Grabbing them only makes it weird for everyone.
What?
Please only touch our devices and service animals if we've given you permission. And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't listen to me just because I have a smile.
Just because I'm blind does not mean I'm deaf.
Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath, relax. We don't bite.
Unless we're really hungry.
Dear lady, how are you?
And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
Morning. Good morning.
Morning, Alice.
Awkward no more. Nice job, Bob. Go forth and be human.
All right, so I think that video does a really good job of showing some of the things that are really important. So some really big takeaways from that video are to never assume that an individual with a disability requires assistance. If it looks like they might need help, you could just ask them, would you like any help? And then let them tell you specifically what they would like assistance with. You should never touch an individual unless they specifically ask you to physically assist them in that way. So if somebody is maybe is using a wheelchair and is asking, hey, well, can you show me where this is, rather than just pushing their wheelchair, which would be touching them and an extension of their body, you could ask them how they would like to be assisted. You would never push an individual who's standing there asking you for directions, and so similarly, you should not push an individual who is using a wheelchair. For individuals who are blind or low vision, it's really important that you introduce yourself and let them know what your voice sounds like and who you are. That way, when you speak in the future, they know who you are, and you can always say like, hey, this is Claire, and then they know it's your voice. Wayfinding is a way of supporting individuals who are blind or low vision by giving them your elbow and allowing them to hold on, and then giving verbal directions. When you give verbal directions when you're wayfinding, it's so that the individual is able to navigate independently in the future so that they know where something is. When you have materials for your business, it's really important to have those available in an alternative format so that people who are blind or low vision are able to access them. So either having a version that's in large print, which would be size 18 to 24 font, and then sans serif. So sans serif is the font without those little curly cues on the end, like Times New Roman has a curly cue, so that is a serif font, and it is a less accessible font, so using a font that's sans serif. It's also important to have an electronic format that's compatible with the screen reader so that individuals with disabilities can access your written materials using a screen reader online. You do want to avoid PDFs if possible because those are not always accessible. When you're using a screen reader, sometimes a PDF won't read at all, or it'll just say a document. So just making sure that they are able to access the same information. And then sometimes Braille, though Braille is not often requested, it's just good to know that that's a resource. You may also need to read aloud any materials that you have, or if you're assisting a customer, helping them with completing paper or electronic forms, or maybe through the payment screen on your touch screen system. Service animals are recognized by the ADA as a dog that can help someone with a disability perform a task directly related to their disability. They are allowed in all City of Chicago facilities and public places. And so something really important to keep in mind is that a service animal can only be a dog or one other animal, which is a miniature horse. I have yet to see a miniature horse in the City of Chicago, but if you do see one, please call me. If the need for a service animal is not super readily apparent to you, the U.S. Department of Justice only allows you to ask 2 questions. So the first one, is this a dog, a service animal, required because of a disability? And what work or task has the dog been trained to perform? So you can only ask those 2 questions. The first one, they say yes or no. They do not have to tell you what their disability is. And then in terms of the work or task that the dog has been trained to perform, they should not be required to show you. They can just tell you what it is. If they answer these 2, that yes, it's because of a disability and this is what it's been trained to perform, then it is considered a service animal. Service animals are not required to have any sort of badging or harness identification. It's really only these 2 questions you can ask. Don't pet a service animal while they're working. They have really important jobs and you don't want to distract them, and it would be really tough to pay attention to your job if somebody were petting you. So just making sure not to touch a service animal, and then keep in mind that service animals are different from emotional support animals. So emotional support animals are not required because of a disability, or they haven't been trained for a specific task, and they are not covered under the ADA. So if you think about you can have a service animal for like a mental health condition, and that's different than an emotional support animal. So a service animal, it would be required because of a disability, maybe for a mental health condition, and what work or task, it would be related to that disability. We do get a lot of questions about service animals. So if the service animal is not under the handler's control, you can request that the handler leave with the dog and return without it. You cannot deny services to that individual, but you are able to ask them to leave and return without the animal if you do not believe it is a service animal, asking those 2 questions. So it needs to be out of control. And so what control looks like is that the service animal should be leashed or harnessed if they're in public, unless that would interfere with the service animal's ability to perform their tasks. So if they need to go retrieve items, they wouldn't be able to do that, but otherwise they should be leashed or harnessed. And then also a dog should not bark more than once in quiet spaces unless provoked, like maybe stepped on a paw or something, then we would expect that, but they shouldn't really bark in quiet spaces, and there shouldn't really be any bathroom accidents. So just keep in mind, access cannot be denied to the individual. And so you can ask them to return without the service animal. And if you do ask somebody to leave with a service animal, it's a good idea to have a removal policy for how to fill out an incident report, just like if you had to ask anybody else to leave your facility. This is really just to make sure that you're protected, especially if you do ask a service animal to leave and it is the legitimate service animal, and then something were to happen to that individual, you would have a documentation. Well, that service animal was out of control, they were growling at customers, etc. So just making sure you have really good documentation if that happens. But service animals go through a lot of training, and they're very, very well behaved. For individuals who are deaf or hard of hearing, ask them how they would prefer to communicate. So some individuals may prefer just to speak or lip read. Some may prefer to write notes back and forth with you or use sign language. Really just ask them how they prefer to communicate. Sometimes I think we ask people, oh, can you lip read? But keep in mind that only 30 to 35% of English is visible on the lips. And so unless somebody tells you that that's their preferred form of communication, just be mindful of that. We want people to make sure that they get all of the information we're communicating with them, not just 30 to 35%. A good tip, if you're not sure how to communicate with somebody, is to use like the Notes app on your phone. Texting was actually created for by individuals who are deaf and hard of hearing to be able to communicate back and forth. So texting or using your Notes app is a great way to communicate. Also, it's important to make sure that people can see your face and mouth when communicating, because a lot is communicated by our physical expression on our face. And this can help aid in the meaning, and then it can also help them see lips in addition to whatever form of communication we're using. When you're using an American Sign Language interpreter, make sure to look at the person who is deaf and not the interpreter. You'll want to avoid referring to the person who is deaf in third person. So you're not going to talk to the interpreter and say, hey, can you tell them that? You just talk to the individual who is deaf like normal. American Sign Language interpreters are very skilled and will catch on to what you're doing. For presentations, programs, or large events, you'll want to provide the ASL interpreter with materials in advance so they have time to prepare. This could be because they may need to know some proper names that are included or some specific terminology. There's not necessarily an American Sign Language sign for every English word. So they may need to think about how to explain concepts from English to American Sign Language. So just having those materials in advance is really helpful. And then you want to make sure that there's seating for individuals who are deaf and their guests with line of sight from the ASL interpreter and the speaker. So you want them to be close together, because if you put the speaker on one side and the American Sign Language interpreter on the other, an individual who is deaf will have what is called the ping pong effect, where they're looking back and forth, and nobody wants to be doing that. So just making sure that they're in one line of sight together. If you do have a long meeting, longer than an hour, or there's a lot of complex terminology, it's really best practice to hire 2 American Sign Language interpreters to make sure that the message is accurate and effective. For individuals with mobility disabilities, I mentioned this earlier, but you do not want to touch an individual or their assistive device without permission. So their assistive device is an extension of their body, and it is their personal space. You'll also want to communicate directly with the person and not the person who is with them or their companion. When you communicate with somebody who's in a wheelchair for an extended period of time, you'll want to position yourselves in a seated position so that you're at eye level with them. And people who use wheelchairs or other mobility devices, they're really their own experts on their own abilities and how to use them. So just trust them that they know best. In communicating with someone who's neurodiverse, neurodiversity is something that I think is a little bit of a newer concept for some people. And this is just the idea that there's variance in how people think, behave, and interact. So when we're talking about individuals who are neurodiverse, it's that variance in how people think, behave, and interact. This can include people with autism, cognitive, developmental, or intellectual disabilities, ADHD, and more. This is best practice all the time, but speak and write in plain language. So plain language is meaning that your message is easily understood the first time someone reads it. So if you're working with people and you're working with customers, it's really important to make sure that you're communicating very clearly. It's also helpful to have symbols or pictures to aid in meaning. So if you think about like you're trying to find the bathroom, there's oftentimes a picture of the bathroom, and that's what's helpful in finding it. And that's really important for many reasons, but you don't need to be able to read, and you don't need to be able to read English to be able to find that when there's use of symbols or pictures. You can also consider using social stories to explain directions. So we have a social story, and what that is it breaks down step by step the process for what is going to happen. So our social story breaks down how to get to our Central West location from public transportation. Oftentimes this can help individuals who are neurodiverse because it helps them understand what to expect in that context. Sometimes we'll receive requests to pause between information, and this is to allow individuals who are neurodiverse time to process information as needed. And then lastly, be mindful of sensory input, such as lights, noise, crowds, or spaces. We're receiving a lot of sensory all the time, and our brains oftentimes filter these out. But if you think about like your clothes on your body, which you've never really thought about before, but now that you're thinking about it, you can feel your clothes on your body. Your brain's filtering that out, but some people's sensory systems are different, and it may not necessarily filter that out. They may be able to hear things that you're not hearing, which is why sometimes individuals will wear headphones. It helps them to filter out some of that unnecessary information that they can hear all the time and can really help them focus better. So now we're going to talk a little bit about business owners with disabilities. So the City of Chicago has a business enterprise owned and operated by people with disabilities certification. And this helps to stimulate the use of small businesses owned and operated by people with disabilities in the City of Chicago. So eligible businesses include for-profit corporations that are 51% or more owned and operated by one or more people with disabilities, a nonprofit that employs people with disabilities, pays at least minimum wage, and whose management and daily business operations are controlled by one or more people with disabilities, and they directly or indirectly serve people with disabilities, or a person with a disability who is contracting with the city as a sole proprietorship or individual. There's no cost for the certification, and the business does need to be located within the Illinois counties of Cook, DuPage, Kane, Will, Lake, or McHenry. Companies who are interested in applying for a BEPD certification, that's that business enterprise owned and operated by people with disabilities certification, they must meet the definition of disabled as outlined in section 292.586, part 2. So with respect to the individual, it's those three parts that I talked about earlier from the ADA: a physical or mental impairment that substantially limits one or major life activities, a record of such an impairment, or being regarded as having such an impairment. And then with respect to a veteran, a disability incurred in the line of duty in the active military, naval, or Air Force as described. So those are the definition of disability that need to be met to qualify for the certification. For MOPD's role in this certification, companies interested for applying, they must first show proof of disability by completing the Schedule G affidavit, I think is how you pronounce that, and an accompanying physician statement. And so then MOPD reviews the Schedule G forms and the doctor's narrative to verify that that individual has a disability based off of the definition, and it goes back to the Department of Procurement with approval. The Career Center is another service that we offer for people with disabilities and specifically entrepreneurs with disabilities. So we can provide individuals with disabilities who are interested in starting their own businesses with resources to be able to do so. If you have any questions, you'll see my contact information a little bit, and you're welcome to reach out to me with questions. There it is. Connect with us. This is the phone number for MOPD, 312-744-7050. We are also on social media, so if you're interested in connecting with us, I encourage you to check out our social media, MOPD Chicago. And then that's my email address there, clarissa.stanhope@cityofchicago.org. Please feel free to reach out to me with any questions that you have. And I did include our training services menu there just in case you're interested. So thank you so much for joining today and for participating. I really appreciate your engagement. So thank you.
Thank you so much, Clarissa. And if you have any questions, as she has indicated on the last slide, that is her email address. So you can feel free to email it directly to her and she will get back with you. Thank you for attending our workshop today, and we hope that you have gotten information that you didn't have before, and that you can use this information when you are working with or facilitating sessions or whatever you may be doing with other business owners that may be people with disabilities. Thank you so much, Clarissa, and we look forward to any updates that you have coming down in the future.